Welcome, friends. Welcome, everyone. This is Dr. Sharad Jaitly from New York. Thank you for watching, learning, and sharing on MuniMeterHealth.com, your favorite website, which is dedicated to spreading the knowledge about the human heart and its illnesses. On this website, we freely disseminate the information not only to our medical fraternity, but also to general masses as much as they can follow. And obviously, we are featuring on two channels continuously, one on Facebook, the other on YouTube. Hopefully you're following on either of them, perhaps on both. That's great. But I again thank you for watching MuniMeterHealth.com, your favorite website, and showing this enthusiastic support in my cause of spreading the education freely to all. Thank you again. Without any further ado, as I always say, let's delve into the state of the matter of the heart. Today we're going to be discussing what is LVAD, which is left ventricular assist devices that are available to us. Now remember, left ventricular assist devices are only incorporated or in your armamentarium of therapy when somebody is having a failure to improve in cardiogenic shock after somebody has received all the possible therapies that can be applied medically. Now you may give IV fluids, obviously. You may give positive inotropes to those patients to build up pressures and improve the cardiac output. You may also use some diuretics, obviously, to see if the kidney functions can improve. When all of this fails, somebody resorts to giving an intra-aortic balloon pump, which works in two ways. One, it improves the coronary vascular perfusion, and two, it reduces the afterload of the left ventricle and eases the left ventricular systole in a way, or emptying in a way. So these mechanisms, when they all fail, that's when we call the cardiogenic shock is refractory, and one can resort to left ventricular assist devices that are available. Now, the first device that comes into your mind and my mind is ECMO. ECMO is essentially extracorporeal membrane oxygenation process, or oxygenator. That's the machine. And it basically, what it does is it takes away the blood, the impure blood, the IVC blood, which is deoxygenated, brings it to an oxygenator. And the oxygenator is right here. And from there, it is shunted back to the aorta. So you have an oxygenated blood coming into the aorta via the IVC. So basically you have in your system two sets of cannulas, one set of cannula which is pumping the blood from IVC into the oxygenator, and the other one pumping it back into the aorta. So as a result, the oxygenated blood is constantly being pumped into the system. And so here you can improve the oxygenation, but you have not unloaded the heart. So ECMO is a good system. It works well. It oxygenates well. Again, it can be very helpful in the first 7 to 10 days while it's on a bridge to receive somebody's on a bridge to receive a left ventricular assist device or a heart transplant. Now, the true left ventricular assist device can be Impella. Now, what is an Impella? An Impella is a catheter or cannula which is passed all the way into the left ventricle, and so from left ventricle one actually sucks in the blood, and it's a very, very small catheter which also has a little 5 mm pump, if you will, and it has a capacity of pumping almost 2.5 liters per minute of blood into the ascending aorta. And basically what it does is the catheter is dropped just like an angiogram catheter. It's dropped into the LV cavity, and when it is dropped into the LV, say if this is your LV cavity, the catheter is dropped via the aorta like this. The blood is being sucked from this inside, and it goes up to the catheter and it is released here. So basically the left ventricle is relieved, and the left ventricle end diastolic pressure, which was obviously elevated, is reduced in a setting where you have blood now straight going into the ascending aorta via the small little pump that is attached within the cannula system. So once again, this arterial cannula, which is inserted through one of the brachial arteries, preferably the right brachial artery, and as the catheter comes in, it's dropped into the aorta, through the aorta, across the valve into the left ventricular cavity. The blood gets sucked in by this rotary powerful pump, which is only 5 millimeters in size. Very, very smart pump. It withdraws about 2.5 liters per minute of that blood within the system here and sends it into the ascending aorta. So this is how the Impella works. So the advantage clearly with Impella is it is an assist device in a way, because it is the world's smallest left ventricular assist device, I call it, and it is inserted percutaneously, and it has almost a 60% improvement in cardiac output, if you will, and the parameters of the LVAD and pulmonary capillary wedge pressures therefore will all improve. The same is true if there was a isolated right ventricular pressure, right ventricular failure. One would use an Impella RP, we call it, and that's the right ventricular straight going to the pulmonary artery. So here the blood is shunted from IVC into the pulmonary artery directly. So the deoxygenated blood that's coming in is coming straight from IVC into the pulmonary artery. So now here, for instance, this was your right ventricle and your IVC is here. So the blood is straight getting into the pulmonary artery, which is here. So now you have a system where the right ventricle, this is your right ventricle, that is much eased. In other words, now you have a right ventricular failure which was existing, and the RV-EDP was high, obviously. So that is reduced. When the RV-EDP was high, you may reduce the RV-EDP by just pumping directly into the pulmonary artery, because the right ventricle is eased and the blood straight from inferior vena cava is pumped into the pulmonary artery. Again, the pump is sitting here, and that also has a similar capacity of 2.5 liters per minute, and it's also inserted percutaneously. So the advantages are very clear. This is for right ventricular failure, isolated failure. We use Impella RP. Plain Impella we use for left ventricular failure, which again, provided the right ventricle is in good shape, so you can use this. And ECMO is really helpful for oxygenation purposes, and one resorts to ECMO also in a setting where there was a cardiac arrest, or there was an indication where there was a cardiogenic shock, which was again refractory, as I said, or sometimes it's almost an equivalent to the cardio-pulmonary bypass pump, which commonly is used for coronary artery bypass surgery. And somebody is not able to wean off. So when you're not able to wean off somebody from a cardiopulmonary bypass pump, you may be able to employ an ECMO there, and an ECMO pump will help alleviate that problem in the next couple of days till the patient is stabilized. So hopefully the inferior vena cava blood will be transferred into the aorta after oxygenation exchange. So the carbon dioxide will be absorbed here, and fresh oxygen will be introduced into the red cells which are coming into the aorta via this system. So those are some of the devices, and there are other devices like tandem and tandem heart, we call it, and then of course the right ventricular and left ventricular assist devices, which are together being used as well. But tandem heart is not so popular anymore. It has numerous problems with hemolysis and coagulations, etc. It employs blood coming in from left atrium into the inferior vena cava, and then into the femoral vein, and then into femoral artery. So the puncture that is created in the interatrial septum is rather huge, and normally that septum requires a patch or a repair later on. So it basically comes in from the left atrium, the blood is coming in and going into the inferior vena cava and down into the femoral veins, and from there it's going into the femoral artery, and it's a way of mechanism where oxygenated blood is coming into the supply of the femoral arteries more easily, and the left ventricle is much eased in that fashion. That's what the philosophy or the pathophysiology is. But anyway, this tandem has not become very popular. So just try to remember ECMO which is an extracorporeal membrane oxygenation process, or oxygenator is the machine. Impella has a very powerful, by the way, Impella comes in 2.5 liters. It comes also in 3.5 and then 5. And 2.5 and 3.5 can be introduced percutaneously very easily. 5 will require an arterial access, but these two are also introduced via the axillary artery. Impella RP is the same Impella, except this is the right ventricular version of it, and therefore it helps the right ventricular failure in this setting, where it pumps directly into the pulmonary artery from the inferior vena cava. Again, hope you found these basic principles of these various devices, left ventricular assist devices, interesting. Again, please refer the textbooks and the literature for more details, but this is a good encapsulated way I could give you in a small little video vignette. So I thank you again for watching MuniMeterHealth.com. Stay tuned for more and more information pouring in, guys. And thank you for your interest and support. Once again, so long. This is Dr. Sharad Jaitly from